that the reason embryos don't implant is because of a genetic problem in the embryo. So when we do PGS, please understand the limitation. There are only 23 pairs, but there are 30,000 genes, and we can't possibly screen for all of these. They've ended up wasting a lot of money, and then they don't have any confidence in the doctor. One of the things a lot of patients don't understand is that PGS or PGD or PGT or pre-implantation genetic screening or testing does not improve IVF success rates. And they can't understand why it doesn't improve it. Every doctor says, yes, if the cycle failed, we need to do PGS the next time. And we all know that the reason embryos don't implant is because of a genetic problem in the embryo. And therefore, PGS is a great idea. After all, if you can test whether the embryo is genetically normal, the pregnancy rate will increase. After all, who wants to put back a genetically abnormal embryo back into the uterus? Sounds like common sense, but doesn't work in practice for multiple reasons. So when we do PGS, please understand the limitation. We can only test 2 or 3 cells out of an embryo which has 100 cells. And more importantly, all we can do is test the number of chromosomes. There are only 23 pairs, but there are 30,000 genes, and we can't possibly screen for all of these, which means a lot of PGS normal embryos will still end up having genetic abnormalities, as a result of which these patients will either not implant or they will get pregnant and still miscarry, which is a double whammy for the patient because they were promised that their success rates would improve or they would not miscarry. So they've ended up wasting a lot of money, and then they don't have any confidence in the doctor at all. And this is why it's important that you have realistic expectation. PGS is a test, but it's full of false positives and false negatives, and it's extremely expensive. So it's not something we would advise patients to do at all.